The World Health Organization says governments must do more to combat the coronavirus pandemic, which has now spread to the vast majority of countries and is known to have infected at least 170,000 people.
All countries must take a comprehensive approach. But the most effective way to prevent infections and save lives is breaking the chains of transmission. And to do that, you must test and isolate. You cannot fight a fire blindfolded, and we cannot stop this pandemic if we don't know who is infected. We have a simple message for all countries: test, test, test. Test every suspected case. If they test positive, isolate them and find out who they have been in close contact with up to 2 days before they developed symptoms.
The WHO boss, Tedros Ghebreyesus, there. Now, Dr. Alexandra Phelan is a global health lawyer with Georgetown University. She's also been appointed to the US National Academies of Sciences Standing Committee on Emerging Infectious Diseases, and she joins us now from New York. Dr. Alexandra Phelan, welcome. So, first of all, what's life like in the city that never sleeps under this new regime?
Yeah, so I've actually been in a sort of social distancing for a few days now already as an asthmatic. From last week, a number of businesses had already shifted to working from home. So people had already been, for people that could, and so people have been working from home if they're able to. The streets are definitely a lot quieter. There's a lot less traffic, both people on foot as well as cars. And in grocery stores, people have been going getting stuff, and there are shelves that are rather empty. But it is a very surreal experience here in New York. Whilst people are going about daily life as much as they can, but it's a lot less people out and about. So,
what do you make of the US response overall so far?
So from the federal level, it has been incredibly disappointing, and it goes to that point that Director General Tedros was making just then. And the CDC's ability to roll out tests and getting tests to state and local public health departments was severely undermined. And as a result, the US has been flying blind in many respects of understanding who actually has the disease, but also that impacts whether you can actually get people to either self-quarantine or self-isolate and stop that spread of transmission. And so we still really are trying to get a handle on actually how wide local transmission is occurring, and that is a number one priority here. We're seeing a shift in government messaging that is moving now towards implementing these social distancing measures. Previously, it has been very much business-led, and at the state and local level, businesses sort of pulling along government. So here in New York, with the mayor and the governor, implementing restaurant, bars, theatres all closing from tomorrow.
Yeah. And amid all this, what did you make of those scenes at airports around the US in the last 48 hours? While there's this national emergency because of a highly transmissible disease, there were tens of thousands of people packed into airports around the US at close quarters because there was a big jam because they were kind of trying to deal with the outbreak.
Yeah, it is a perfect example of why hasty policymaking on the fly is incredibly dangerous for public health. What we have here is now people all transiting back and essentially being in a position where they are in close contact with many other people who may or may not or be infected, and that is a significant transmission risk. It's the exact opposite of all the messaging that public health officials have been making, and that is a direct consequence of a European travel ban by the US on Europe that was put into place very hasty at last minute and caused people to respond exactly how you would expect them to respond, and without ensuring that airports were adequately ready to respond to the influx of people coming home.
So what are the numbers in the US at the moment, and taking into account what's happened in other countries, how do you expect that curve to go over the next couple of weeks? I think, is it about kind of 1,400 or 1,500 people so far in the US?
So I apologise, I don't actually have the figures right in front of me to go. But what we do expect to see is, as testing is rolled out, we will see cases jumping. And you'd see a similar situation in Australia as more people are tested. And that's a reflection of testing being rolled out, not necessarily cases increasing. That being said, we are seeing, obviously, there is the significant local transmission occurring in the United States. And so we are really in the beginning of the curve going up on the epidemic curve that we expect to see more cases. Yeah. Particularly if measures are not put in place urgently.
Taking into account what kind of country the US is, like one of the most advanced countries in the world, a developed country, how do you feel about how this has been approached by authorities when there was warning, when China was the example of what could happen, there was warning of this? And for those of us that work in pandemic preparedness, these are the messages we've been saying for at least a decade, if not longer, for those that are more senior than me. That this is all to be expected in terms of the policies and the procedures that we put in place for preparedness not being followed. And so, given that there was this early alert as well with the outbreak in China, it is even more disappointing and morally repugnant that these measures were not addressed and put in place. We're seeing hasty policy on the fly that is perhaps 2 weeks too late in many respects to slow down transmission. The biggest concern is that the United States doesn't have universal healthcare, does not have accessible healthcare. It has a healthcare system that is already at risk of potentially being overwhelmed, and when we do start to see cases increasing, if we haven't had this surveillance to then self-isolate and self-quarantine contacts of people who are sick, and to understand this burden, and without these social distancing measures being put in place early enough, we are really at risk of seeing the healthcare system, ICUs being overwhelmed. And this is a disease that, whilst it might only affect 20% of the population in the severe form, that is enough to completely overwhelm a healthcare system, and that's why that social distancing and that testing is both so critical right now. So do you expect it'll be the case that at least thousands of Americans will die over the coming months, if not tens of thousands?
So, models say different things, and, there may be one model that is going to be accurate and have modelled exactly the situation, but, it's hard to sort of predict based on that. But what the head of Dr. Fauci, the head of the National Institute for Allergies and Infectious, sorry, I'm going to get the acronym wrong on the fly, the NIAID, who's leading the response, has said is that we are in this for the long haul. We are at the beginning, and it's going to get a lot worse. So putting an exact figure on that, I would be hesitant to do that. It's not my particular expertise, but we would expect this to get quite significant in terms of the number of people who die.
Okay, Alexandra Phelan, thanks so much for talking to us from New York City.
Thanks for having me.